episode of Vlogmas. So as you can tell by the title up at the top or at the bottom, this is going to be my registered nurse and nurse practitioner Q&A that I asked you guys a few weeks, maybe not a few months, a few weeks back about. I asked for you to leave any questions, comments that you had about being a registered nurse or a nurse practitioner. And I also went through some of my old nursing videos and went through a lot of the comments, and I'm going to go over some of the questions for the comments. So let's just get started. I did go through and type up all the questions here, so you will see me using my phone, but of course the question will be down at the bottom. One moment. So I'm going to start off by introducing myself. If this is your first video, welcome to Janine's Journey. And I initially started this YouTube channel a year and a half ago to document my last year of nurse practitioner school. My career history and background is I am a pediatric nurse, first by heart, by nature, and I have been a pediatric nurse this year, now going on almost 8 years. So I initially started off in pediatrics. Actually, if you haven't, make sure you go look at why I became a pediatric nurse. But initially I started off as an OBGYN nurse. I used to want to work in labor delivery. I was obsessed with working in labor and delivery. While I was in nursing school, I worked as a labor and delivery nurse extern, and I really thought that that's where I wanted to be. Fast forward, after I finished school, I got my first job as a registered nurse in an OBGYN's office. And Dr. Nova, I love him to death. He helped me to get my first acute care position at the hospital in Tallahassee, Florida at that time. And I met with the director of the pediatric unit, interview, and then that's where my love of pediatrics came. So I worked in Tallahassee for about a year, and then I became a travel nurse, a pediatric travel nurse, and I traveled from Florida to Connecticut to California to Georgia, and then back home to Florida. I moved back home to Florida. I interviewed for several jobs, one being a pediatric nurse office job and another being a NICU nurse. Because while I was traveling, I did train as a float nurse so that I could float to the NICU. And as a registered nurse, you do have to float sometimes if the census is low in your unit. So I would float to NICU and to the nursery. Those are my specialties: NICU, nursery, pediatrics, PICU. And NICU is neonatal intensive care unit, PICU is pediatric intensive care unit. So using the experience that I had as a travel nurse and floating to NICU, I ended up accepting a position here in Tampa, Florida as a NICU registered nurse. After working in the NICU for about a year, I just realized how much I truly love pediatrics, and I transferred back to pediatrics. I enjoy talking to little people, interacting with them, getting to know them and their families. So as a pediatric nurse, my favorite age group, my favorite population to work with are of course infants. Then my next favorite group are the school age kids. And school age kids are, I really like that 5 to 8, 5 to 10 age range. They're really cool. Now anything after that, teenagers, preteens, blah, toddlers, blah. Sometimes it's hard to care for them just because of where they are developmentally. But that's a little bit about me. That is about my history as a registered nurse. Fast forward, I moved here to Tampa so that I could go to the University of South Florida, and moved here to Tampa to become a pediatric nurse practitioner. A pediatric nurse practitioner primary care focus program at University of South Florida. And there are very few pediatric nurse practitioner programs or focus programs around this country. I got accepted into University of South Florida, where I completed 2 years and got my master's in nursing. And now I practice as a primary care pediatric nurse practitioner. Woo! Mouthful. Make sure you go check out my nurse practitioner update. I did film that a few days ago, so make sure you check that out. So fast forward to where we are now. I am now practicing full-time as a primary care pediatric nurse practitioner. I work in a pediatrician's office, and occasionally I pick up shifts as an urgent care nurse practitioner. Whew. My history. So I just want to give you a little bit of my background and why I do this. And I often would turn to YouTube for actually everything. I love YouTube for everything. I love to look at YouTube for school. I love to look at YouTube for decorating and balloons and hair, like just everything. So I decided that I wanted to start my YouTube journey and help others like me who needed help with guidance in school, you know. And I love looking at days in the life. How is it gonna be when I become a nurse? How is it gonna be when I became a nurse practitioner? And I know it's still difficult to kind of convey that because you don't know how you're gonna feel. You're thinking, oh, if she can do it or if he can do it, it's something that I could do. But you just never know until you do it. And like I said, make sure you check out my nurse practitioner update. Anywho, let's get into this Q&A. So the first one was, what type of nurse was I? I was a pediatric registered nurse. I also worked as a neonatal intensive care unit nurse. All right, next question. Was it hard to deal with pediatric dosing? Not at all, because as a registered nursing student or a nursing student, you have to take for me, and I think from a lot of the nurses that I know and friends that I have in this field, you have to take a dosing test every semester. Community college that I went to in Baltimore, we had to take a dosing class every semester. When you start at the hospital, you have to take a dosing test. So it is something that is very important because you do have to make sure the medication you are given is the correct dosage. And in pediatric population, not to say it's not important in an adult population, but in a pediatric population, everything is weight based. And so you have to turn all pounds into kilos, and most medications are milligrams based upon kilograms. So you just want to make sure you are calculating your dosing correctly. How many patients as a pediatric RN do you typically have? So when I worked in California, there's a mandated ratio of 1 nurse to 4 patients. But in other states and cities, it's not a mandate. In every other state in the country, there is no mandate. Most hospitals would not give you more than 5 patients per nurse as a pediatric patient. As a pediatric nurse, I have had up to 5 or 6 pediatric patients. While that is truly not a safe patient ratio, dealing with smaller kids, especially at nighttime, who can crash easily. Perfect ratio, I would say it's 1 to 4. I've had up to 5 or 6 before, but very rarely did I get up to 6 patients. If we're getting up to that 5 to 6 patient mark, we are calling another nurse. So this one is, how difficult was it finding preceptors? And that is for a nurse practitioner student. And one reason why I chose University of South Florida was that the program looked for my clinical placement for me, so I did not have to look for preceptors. But my second choice was University of Alabama at Birmingham. And the reason I really did not go with them was because I would have had to find my preceptor, and I hear it's very, very difficult to find a preceptor. Now, another good tip if you're looking for preceptors are, you're working as a registered nurse. Make sure you're using your contacts, you're using your resources. Ask the doctors or nurse practitioners that you work with at your clinic or hospital, hey, I'm in school, do you mind if I get hours with you? Now, it did become a little difficult during the pandemic where some of us did have to find our own clinical placement. And as you guys know, my mentor, Dr. Smith, she took me under her wing, and I did all of my clinical care hours actually here at the urgent care that I'm at now, and now an employee. So just, use your resources. Ask your friends, your other nurse practitioner friends if you have any, or just ask around like, hey, I need hours, do you know anyone that I can do them with? Whatever field you're deciding to go in, hopefully you have some experience in that field, and hopefully you know some people that you can possibly ask, hey, I need hours, can you? How hard was it finding a job after graduation? And I think that is a relevant question for both registered nurse and nurse practitioner, because when you graduate nursing school, they say, oh, it's a shortage. It's a shortage of nurses, and there's a shortage of nurse practitioners. Difficult because a lot of places want experienced people. So once again, when you're in your clinical experience, making sure you're creating those bonds, you are networking, you are, hey, I'll be done with school, in this amount of time, what's up? It did take me a little longer to find the job as a registered nurse because I moved from Baltimore back home to Florida, and I should say it took me long, but because I graduated in May and I had a job in July. But I say it took me a while because I graduated in May, but I didn't get my first acute care position until November of that year. So it took me some time to get a job and a position as a registered nurse. Now as a nurse practitioner, it didn't take me long at all, just because, like I said, I had created those bonds. I had started that networking while I was in school, putting my ear to the ground like, hey, do you know anyone that's going to be hiring? Here, the office manager, I bugged her every time I saw her at one of the offices, like, hey, I'm graduating December, I'll take boards in January, blah, 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 like, I'm going to be ready, what do I need to do? Like, she's like, just make sure as soon as you're done, do this, X, Y, and Z. So, as a nurse practitioner, it was a little bit easier to find that first initial job, and my urgent care job is a PRN job. It did take me a little longer to get into that primary care setting. What do you have to major in to become a nurse? If you're coming straight out of high school, you can do pre-nursing, and what that means is you're going to take all the courses that you need in order to apply to nursing school. And I have an entire video on how do you become a registered nurse, and I'll link it up above and down below as well. I'm pretty sure I'm running out of cards at the top with all the videos that I'm linking. So what you have to major in: pre-nursing, health, sciences. Usually pre-nursing is all you have to major in so that you can make sure you're on the correct pathway in order to apply to nursing school. You have to be good at math, and this goes with that dosing question. You have to be good at basic math, like algebra. I know, like, you're probably taking calculus and pre-calculus and trigonometry, but honestly you need to know basic algebra equations. Can you work full-time while in school to become a nurse? And the answer to that question is, it depends. It depends on your work, family, life balance. I don't have any children, I don't have a husband, I only had me to care for and to think about. So while it is difficult, even if you are a single person with no other responsibilities besides being an adult and paying bills, it is difficult to be full-time. But I did go to school full-time. I went to school full-time and completed my nurse practitioner program. Now, most programs are going to tell you to not work full-time because they want you to be as successful as possible. There were times where me and my friend Ashley in school, we would call out of work a lot of the times, especially when it came down to finding clinicals and doing clinical hours. You have a lot of hours you have to do. You have to complete 520 hours within a year's time frame. In order to sit for boards, you have to have 500 hours, but our school required us to have 520 clinical hours. And so that's only during school time. So, or that's only while the semester is present. Like, we couldn't do it if we were on break from school, like spring break, winter break, or summer break. While that first part, you can definitely be full-time. When you start clinical, it's going to be impossible to be full-time. So the answer to that is, can you work full-time? You can, but it is going to be difficult and you are going to have some hurdles to jump over. Did me working as a pediatric registered nurse prepare me for working as a PD and Ped? Absolutely. Absolutely, because I already have a long 7-year foundation, or at that time 5 years foundation to build upon, and it absolutely helped me because I'm not starting from scratch. I know the pediatric population, because if you're working with adults, not to say that it can't be done, but working with adults and working with children, the practice is different. A lot of the diagnoses are completely different. So yes, my background as a pediatric registered nurse prepared me to be a pediatric nurse practitioner. Do you ever get bored as an RN or NP? Absolutely not. No, I am not bored whatsoever. No, not even as a registered nurse. And if you do get bored as a registered nurse at a hospital or wherever you're working at, become a travel nurse, and you really won't be bored because you'll move around every 13 weeks, every 17 weeks, or however often you want to move around. So absolutely not. You cannot get bored working as a registered nurse, and as a pediatric nurse practitioner, heck no. Make sure you once again check out my nurse practitioner update, because I'm at the beginning of my career and I am seeing things that I've never even seen before as a registered nurse. And once again, I was an acute care registered nurse, and so working as an outpatient primary care nurse is a little bit different. You see different diagnoses, but no, not bored at all. I got about 10 charts I need to go complete while I'm at a second job and working my third job as a YouTuber. So no, I am not bored. I do not get bored. Well, while it can become monotonous at times, something that happened and it is just like, oh, whew, okay, now I want to be bored. Is nursing school hard? Yes, 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 yes. But it is very rewarding, and it's rewarding, and it's worth it. It's not an easy profession to be a part of whatsoever, but the reward you get, the feeling you get from helping others, it is unmeasurable. It's worth the hard work, because you're truly, for some people, are making a difference in their lives, and you're helping them. So I needed this video because it's reminding me of how much I love working in pediatrics and how much I love what I do. And yes, it's difficult at times, but for me, it's worth it because I love the great parents and patients that I interact with and encounter, and those who actually are helping and making a difference in their lives. So yes, it's hard. I wanted to drop out of nurse practitioner school. I wanted to drop out of RN school. But I was like, if I drop out of school, I don't want to be, at that time I was working as a pharmacy tech when I was a registered nurse. I didn't want to be a pharmacy tech forever. I didn't want to go back to be a pharmacist. I didn't. So it was do or die. And I am so glad I stuck it through. I am so glad for how my career and my path turned out, my journey turned out, because I wouldn't trade it for the world. Was it hard going from night shift to day shift? Yes and no. So yes, because there's way more people on day shift. There's way more to do on day shift. There's way more politics on day shift. Your patients are up on day shift. And no, it wasn't hard because I really, I had been working at that time 5 or 6 years overnight, and I really was a zombie. And while the rest of the world was sleeping, I was always up at nighttime, and I just wanted to be on a normal schedule. I hate saying normal, but I wanted to be, you know, on a semi-normal schedule. I didn't want to be a zombie working at night anymore. Was the transition from NICU to peds? Oh, how was the transition from NICU to peds? So, like I said before, I was a pediatric nurse, then I became a NICU nurse, then I came back to being pediatrics. So how was the transition from peds to NICU? I would say it was a little bit difficult because I was a medical surgical pediatric nurse. All right, I had to let Miss Sharon in. Okay, what was we talking about? Do I have any report? Oh, was it hard transition from NICU to peds? So it was a little bit different and difficult because I went from a medical surgical unit to an intensive care unit and only working with really small babies who are still supposed to be inside their mommy's baking. So my smallest baby I had ever taken care of was a 720 gram baby. And yeah, that was a little scary. I really did, because I'm not working right now as a registered nurse, and did enjoy working as a NICU nurse, but like I said, the pediatric population just spoke a little bit more to me because my patients could speak with me. Any tips for working with kids? Yes. Communicate on the child's eye level. Don't go and rush in and start right away with checking your IV, getting blood vitals, getting blood pressure. You know, don't go straight in being a nurse. Go in, connect with the patient, especially your smaller patients. Your older patients, they know why they're there. They can comprehend what's going on. But your younger patients, they're scared, they're terrified. So speak with them in a low tone, to communicate with them. Let them know exactly what you're doing, especially the toddler to school age group, because they would want to when they tell you these kids want to negotiate with you, they really try to negotiate with you and put things off. So just making sure you're communicating with them at eye level before you begin your exam, exactly what you're doing. Making sure you're recognizing their bravery and cheering them on and encouraging them, because they really, really love that. And try to make some connection with them. Like the other day, I had a patient in the office, and she had on her stethoscope and she had her little big syringe. So before I did anything, I got down to her eye level, introduced myself, and I was like, oh, I see you're a doctor too. Do you want to listen to my heart with your stethoscope? Do you want to give me a shot? And she gave me like a million shots before I left out the room. But you want to speak and connect with them on their level before you start anything. How many days do you work as a registered nurse? Most registered nurses, if you are a staff registered nurse, you are contracted to work 36 hours, which means you are contracted to work 3 12-hour shifts. Now, that is what your minimum, that's what you have to work every week, a minimum. Now, you can go above and beyond that. It's always overtime. I sometimes would work 7, 8, 9, 10. I think 10 is my max nights that I've worked in a row as a registered nurse. 10, 12-hour shifts. While a lot of places are no longer letting nurses do that because of burnout, because of mistakes that could be made, because you're sleep deprived, you're tired, you are only contracted to work your 36 hours, which means 3 12-hour shifts. You work 3 days a week. So when you work 12 hours, how do you have time to rest and have free time? You work 3 12-hour shifts, so that means you have 4 days off to rest and to do whatever it is you want to do. And when I would go on vacations, I would, if I could, work the first 3 days of that 1 week, so Sunday, Monday, Tuesday, and then I would have Wednesday, Thursday, Friday, Saturday off of that week, and then on that next week, work the back end so that I can have 8 days off in a row. So there's time. You just have to make the time. Where can you work as a registered nurse? You can work anywhere as a registered nurse, and I am not joking. You can work on a cruise ship, you can work in a hospital, you can work in a clinic, you can work at a school, you can work anywhere. You can work in a prison, you can work. I actually have a video, now that I think about it, of where exactly it is you can work as a registered nurse, so make sure you check that out. All types of specialties that you can work in. What degree do you have to be a pediatric nurse? I got my Bachelor's of Science in Nursing, and I have my Associate's degree in nursing as well, my Associate's of Science in Nursing. Where do you get your scrubs from? Ooh, so before I start, I got my nice, cutest bits of scrubs. As you knew, make sure you check out my try-on haul. I would get them from any scrub store in town or Walmart. Do you have to wear a mask? Did you have to wear a mask 24/7 before the pandemic? Absolutely not. The only time you had to wear a mask if a patient was on droplet precaution, meaning they could spread their flu or any other respiratory virus they may have had to you via droplets. So you would have to wear a mask, gown, and gloves to always go into those rooms. Anytime you had a kid who came back positive for anything on a respiratory panel, you did have to wear full PPE, which is personal protective equipment. But now, because of the pandemic, we have to wear masks 24/7 now. What is charting? So I'm trying to figure out how I can show you guys how to chart. And I think what I'm gonna have to do is create my own spreadsheet that way I can share my screen and show you how I chart. All right, so charting is basically everything from the time you get to work to the time you leave. You are documenting. It's your documentation. So you have to document your physical assessment. You have to go in at the beginning of your shift as a registered nurse. The time you get there, the time you leave. So you do a physical assessment at the beginning, a full head-to-toe physical assessment at the beginning of your shift. You have to chart that. You have to chart all the medications you give, meaning you go in and document what time you gave it, what route you gave it, and if the kid had any side effects. You just have to keep track of that. Chart and document when you go in and draw labs. You chart and document what the patient's eating, their input, output, so how many times they've gone to the bathroom. If they're on strict INOs, you have to chart the exact amount that they have avoided and the exact amount they've stewed and the exact amount that they have drank and eaten for the day. You have to chart your vitals, so blood pressure, temperatures, you have to put that in depending upon what unit you're on. Med surg, we have to do vitals every 4 hours depending upon the diagnoses. ICU every hour, every 2 hours depending upon the diagnoses. You have to basically document that the patient is still alive and that the patient is progressing towards being discharged home. Do you get infants on the pediatric floor? Yes, infants do after they are discharged home from mother baby. If they do need to come back into the hospital, most hospitals put them on a pediatric floor. Some hospitals put them in a NICU unit. It just depends kind of what they're coming back for. If you have a jaundice baby, a baby who's yellow, then yes, they could come to the pediatric floor and they would put them on, we call them suntan, sunbed, but they'll get phototherapy. If they have infection, they come back. So as a pediatric nurse, you are able to take care of children from birth or 2 days old, a day old, until 21 years of age. How to stay organized in nursing school. I'm about to pull out my planner. I write everything down. That's it. You have to write all your assignments down, all your tests down, all your work schedule, your shifts down. You let your family and friends know that this is my schedule. If you want me to put anything on my calendar so I can take off and make sure I've studied and for my tests and did my assignments, you have to write everything down in order to stay organized, or you will fail. How do you keep going when it gets hard? I like that question. And it's the last question, by the way. This is question 26. How do you keep going when it gets hard? And the answer to that is you remember why you did this in the first place. You remember that it can be difficult, but definitely it's very rewarding taking care of patients who truly are thankful to have you as a provider in their life that makes a difference. And I just remember why I do this. It's not just because of the money, because this is not an easy way to make money whatsoever. It is very hard. So it's never about the money, which we do or can have the ability to make really good money as registered nurses with all the overtime we can pick up. But you just remember those good patients and those good times that you had, and just focus on that in order to keep going and keep making it through. So that is it. I hope you enjoyed this video. If you have any more questions, drop them down below. I can definitely do a part 2 or a part 3 because it's maybe 2 parts. But if you have any other questions, you guys know how to contact me. You can hit me down below in the comment section. You can hit me over on my DMs on Instagram. You can shoot me an email, JanineSjourney@gmail.com. But as always, thank you guys for tuning in to Janine's Journey. You already know what I'm about to say. You already know what to do. Make sure you give this video a thumbs up. Make sure you leave any comments you have down below. Make sure you subscribe over here. And make sure you tell a friend. And I'll see you guys in the next Vlogmas video.